Hi there, this is Dr. John from the Florida Center for Hormones and Wellness. And today I want to talk about a very interesting subject, and that is the difference between normal laboratory values and optimal laboratory values. And this is an issue that should be very simple to understand, but really creates a lot of confusion and misunderstanding among everyday doctors. Normal is a term that's used to describe a statistical average. That is, you take, say, 1,000 people of your age group who aren't complaining of a particular symptom relating to a hormone, you draw their blood, and you measure the value of that hormone in the blood. And what's going to happen is you're going to get what's called a normal distribution. For those of you who understand statistics are going to get that right away, but for those of you who don't, what that means is that you're going to have a lot of people centered around the average, and then the further that you get away from the average, it's going to either trail off in numbers on the high side or on the low side. Well, then what we do is we apply a statistical test to those numbers, and we go up what's called two standard deviations, or about 96% of the people with 2% on the high side, 2% on the low side. We chop that off and we say the high guys are abnormal and the low guys are abnormal. And in that whole evaluation, we've spoken nothing about the quality of what the patient experienced. It's just a statistical test to determine whether or not a laboratory value falls within a specific range. Well, that people don't care about statistical averages, they care about how they feel. That's where the term optimum comes in. So the word optimum means at what blood level do you feel your best? And that's what we're looking for in a wellness center, okay? We're not just looking for you to be normal. To be perfectly frank with you, I'm 63 years old, and I don't want to be a normal 63-year-old. I want to be vital, I want to be active, I want to be vigorous, I want to be healthier than the average 63-year-old. So I don't particularly want to I don't particularly want to compare my blood values to those of other 63 years old. I want to compare my blood values to younger people who are more vigorous and more vital, because those are the level of the hormones that I want. In addition, there are certain environmental influences and impacts upon the way that the hormones interact with your body that may require you to be at a higher level in order to get a better effect. So it's that level at which you feel best, that is that level at which you're optimized, that is most important to me. And that level may be a lot higher than what's called normal. So I'm always looking for the optimum blood level in any particular individual. Now I know what that optimal number may be in a whole group of patients, and it's many times it's a little bit higher than what the normal numbers are. And we often see that when you have a hormone that's low, people feel a certain way. And then as you increase it and you increase it and you increase it and you increase it, they feel a little bit better, a little bit better, and a little bit better, and a little bit better. And so why not keep increasing until you get the maximum benefit from that increase, the maximum benefit from that hormone? That is, we're optimizing it as we go along in response to an individual's symptomatic needs. So that's what we call optimization. So an optimized hormone level may be a little bit or even a lot greater than a normal level. When we do that, there's one very, very important question to ask. Is there a level at which we can go too high? And it's a very valid question, and we always pay attention to that. And I read and I study and I read and I study, and I'm always looking for indicators or warning signs of things to be cautious about. And I can assure you that in the medical literature today, within the values and the laboratory levels that we use in this office and others who practice medicine the way that I do, the levels that we go to are perfectly safe, they're effective, and while sometimes it may cause some excess effects, that is a little bit too much of what the hormones do, I cannot permanently hurt you by going to an optimized level as opposed to just keeping you within that normal range. So I hope this little explanation explains the difference between normal and optimal. And in this office, we're always looking to optimize your health, your well-being, and your vitality so that you're always ready to attack the future at its best and be your best and live the best life that you can. This is Dr. John from the Florida Center for Hormones and Wellness.